Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin, I want to address a question that I've heard is causing confusion for people. The question is, if you're a parent and your child becomes sick but hasn't tested positive for COVID-19, do you need to isolate? This is a good question. If your child has not been identified as a close contact of a COVID case, and if they have not tested positive, you do not have to self-isolate away from others, although the child who is sick would be kept away from others in the home. For young children, it may be best to have only one parent provide care in order to limit contact. You may choose to stay home, but you are not legally required to do so. You should continue to take all the normal precautions, including monitoring yourself for symptoms, washing your hands, and staying physically distant from others. The reason for this is that our COVID positivity rates for school-aged children right now are less than 1%. So while we recommend that children who are sick should stay home and get tested, their household contacts are not required to self-isolate unless the test comes back positive or that child is a close contact of a confirmed COVID case. I know this is a challenging time, and I will continue to address any questions I hear in the days ahead. Turning to today's numbers. Currently, 77 people are in hospital in Alberta, including 13 in intensive care. We have identified 364 new cases of COVID-19, while our labs conducted more than 16,400 tests. 276 of those new cases are in Edmonton. As of today, AHS has confirmed that students and staff at 55 schools that previously had alerts are now back in class and off the list. There are active alerts or outbreaks in 170 schools, which is about 7% of all the schools in the province. Currently, these schools have 370 active cases in total. This number includes 72 schools that are on outbreak, including 14 currently on the watch list. Once again, I want to remind everyone that we are defining 2 cases as an outbreak, which is a very low threshold and reflective of a very cautious approach. It also takes 28 days or 4 weeks with no new cases before a school comes off of outbreak, so many of these schools have not had new cases recently. So far, in-school transmission has likely occurred in 27 schools. Of these, 21 have had only one new case as a result. Sadly, I must also report 2 new deaths in Alberta. These deaths were both in patients at the Foothills Medical Centre. They were announced yesterday by AHS. I want to express my heartfelt condolences to everyone who has lost a loved one to COVID or any other cause during these difficult months. There are currently 83 cases, including 42 patients linked to the Foothills Medical Centre outbreak. More than 2,300 tests have been conducted as Alberta Health Services is taking aggressive measures to identify any potential individuals who may have been exposed. There is also an outbreak now connected to 2 units at the Misericordia Community Hospital. In total, 10 cases are linked so far, and widespread testing is underway. My colleagues have informed me that outbreak protocols are being implemented at the hospital to ensure the ongoing protection of patients, staff, and visitors. Visitation to the affected units is restricted, but the hospital outside of those units remains safe for patients. Today, I would like to update you on COVID-19 in the Edmonton zone and announce new voluntary public health measures for the capital region. As I said on Monday, I am very concerned about the sharp rise in cases that we are seeing. As of today, there are more than 1,250 active cases in the zone. Over the past week, the positivity rate has increased to 4% in Edmonton. And the R value for Edmonton, which measures how many new cases on average are infected by each person who already has the virus, has risen from 1 to 1.3 in the past week. My team and AHS have been closely investigating the spread of the virus in the city. All parts of the Edmonton zone are being impacted by the rising spread of the virus, either directly or indirectly. While case ratios are highest in the northeast portions of the city of Edmonton, they are also high in southern Edmonton and other areas as well. As I mentioned on Friday, about 11% of active cases in Edmonton worked or attended social gatherings while symptomatic, which is concerning. Currently, about 36%, almost 2 out of 5 cases in Edmonton, were exposed by a close contact. Another 26% are linked to an outbreak. Where transmission is known, household or community contacts appear to be a key driver in spreading the virus throughout the city. Social gatherings and family gatherings continue to be a factor in virus-spreading events. We have also seen several workplace outbreaks where spread between employees has occurred, showcasing an opportunity to improve prevention measures within workplaces. The Edmonton zone now faces a crucial juncture. While the system is able to support the current caseload in hospitals and ICUs, the acute care impact is a lagging indicator. It typically takes 1 to 2 weeks before a rise in cases contributes to a rise in hospitalizations. We have been in close contact with officials in the City of Edmonton and other partners across the zone regarding this situation. We must take action to slow the virus's spread in the zone and make sure the health system can continue supporting Albertans with COVID-19, influenza, and many other needs. That is why, effective today, I am announcing 3 new voluntary public health measures in the Edmonton zone. These measures are voluntary because we still have sufficient hospital beds and capacity to meet the current needs in Edmonton. But we are moving forward with them because it is important to use our current data as a call to action. First, all family and private social gatherings should be limited to no more than 15 people. This is the maximum. The fewer people we come into contact with, the lower the risk of exposure or of us exposing others. This does not impact schools or more formal gatherings such as theatres, worship services, or other gatherings where an organizer is ensuring that all COVID guidance is in place. In these other settings, though, it is critical that all COVID guidance be followed carefully. For wedding receptions and funeral receptions, we recognize that these events in the near term have had a great deal of planning that has gone into them. It may not be possible to reduce these immediately to 15. However, if possible, we would encourage anyone planning these kinds of private social events or parties and family gatherings to reduce numbers as much as possible, aiming for no more than 15. Second, I am recommending that masks should be worn in all indoor work settings, except when alone in workspaces, such as cubicles or offices where you can be safely distanced from others or an appropriate barrier is in place. Finally, I am asking everyone in the Edmonton zone to limit their cohorts to no more than 3. Their core household cohort, their school cohort, and no more than 1 other social, sport, or other group. In some rare cases, individuals may belong to a work cohort as one of the 3, but this is not something that everyone would be a part of. Remember that a cohort is a group of people who don't have to follow all COVID restrictions at all times to enable an activity such as a team sport to take place. This is not the case in most workplaces. In almost all workplaces, measures should be in place to prevent close contact between co-workers, and therefore they would not be considered a cohort. Young children who attend childcare could be part of 4 cohorts, given that childcare cohorts have not been seen to be a high-risk context for spread, and young children are at lower risk of spreading the virus. These measures are not being taken lightly, but are necessary to prevent the spread of COVID-19 from continuing to escalate. Alberta Health Services will be continuing inspections of public serving businesses to ensure that existing guidance is being followed. In the coming days, the Alberta Government will continue to support vulnerable Albertans and those most at risk of severe outcomes from COVID-19 to minimize the risk of exposure. While these measures are voluntary, I live and work in Edmonton and I know that our community looks out for one another. I believe people will do their part to protect themselves and their family, friends, and neighbours. We will continue working with Alberta Health Services and local municipalities to closely analyze and monitor the spread in Edmonton and across the province. We will continue to assess the impact of these recommendations and consider any adjustments if needed. While these voluntary measures are focused on the Edmonton zone, everyone in the province should take note. We must all take precautions to limit the virus's spread to our friends, family, and loved ones. I especially caution Albertans against planning large get-togethers this weekend. Now is not the time to be gathering in large groups, traveling long distances for the holiday, or sharing food or utensils with people outside your cohort. Keep your Thanksgiving small, keep it safe, and protect one another. I know that the need for voluntary measures and the caution against gathering with extended family and friends is disappointing to many. It has been a long, hard year, and the fight against COVID is far from over. But we have learned much about this virus, and our collective action is incredibly powerful. By working together, we can all protect each other, reduce the spread, and lift these measures as soon as possible. Now more than ever, we need to take care of each other and help protect each other. As we look forward to this Thanksgiving weekend, we still have many things to be thankful for. I've heard many stories in the past weeks of people stepping up and going above and beyond to protect their communities. This is part of who we are as Albertans. We remain in this together, and the future is in our hands. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. We have a very large queue, so I would ask callers to keep the question to one only so we can get through as many as possible. Operator, could you put through the first one, please?
Thank you. Yes, the first question is from Jeff Slack, 660 News.
Hi, Dr. Hinshaw. How concerned are you about this new amount of case numbers reported, especially with Thanksgiving and Halloween coming up? Do you see Alberta surging in cases in November? And do you think Calgary will have to see increased restrictions as well?
The concern that I have at this time really is focused on Edmonton. We have seen what other jurisdictions have seen, where case counts stay relatively stable and then can suddenly turn a corner when the reproductive rate goes up. Thankfully, the rest of the province still seems to be holding steady. But again, what I would say is that in the rest of the province, this is an opportunity to keep doing all of those things that are keeping the rest of the province relatively stable. And in Edmonton, this is an opportunity to enhance our approach. And again, I think it's very likely that we can collectively turn the corner and bring this curve down, reverse that trend. Certainly with Thanksgiving coming up, of course, if people are gathering in large groups, that does present an opportunity for spread, so I strongly advise against that. While I know it's disappointing, it also is necessary, because right now the last thing we want is to spread this virus to our friends and loved ones, especially those who are at high risk of severe outcomes. And the question about whether or not additional restrictions may be needed, again, is entirely in our hands.
Operator, could you put through the next caller, please?
Yes, the next question is from Audrey Naveau, Radio Canada.
Hi, Dr. Hinshaw. I just wanted to have a clarification before my question. You mentioned the three cohorts, like the three different ones that people can have. Do these cohorts need to be kind of like self-limited, meaning that everyone in the cohort agrees that this is the cohort and that they're not having different ones? I'm just thinking that it might, some people seem to think that they can choose their cohort, but not everyone inside agrees that this is the one that they're in. And my question, wanted to know, why not make these measures mandatory? Why make them voluntary only?
The question about cohorts, indeed, as you say, and I do think there has been some confusion maybe about cohorts, but the definition of a cohort is a group of people who all agree that they will be in that one cohort together and not be part of other cohorts. So, for example, I mentioned the sports cohort. So while in the past we had said we recommended limiting but didn't provide a specific number, now we're saying we recommend that people should be only part of one sports cohort. So if they're playing on a particular team, they would only play on that team and they would not play with other teams. I will specifically say that that does not apply to schools at this time. We are recommending that schools, again, that school cohort can include school sports, but outside of that context, again, it would be only one sports cohort. Or for that social cohort, again, that would be a group of people who agree that they will only spend time together as that one group. Then the second question about why not make it mandatory, we have been clear with the relaunch framework about the two measures that would cause mandatory restrictions to come back in place, which is a rise in hospitalizations of greater than 5% over 2 weeks, or an increase in ICU bed utilization so that 50% or more of our ICU beds are occupied. And in order to be transparent, we've been very clear with Albertans that these are the measures to move into mandatory restrictions. And so at this time, what we're saying is that we know that transmission events that happened in the past 1 to 2 weeks are causing the cases we see today. And so we know that making this change today will not impact our case numbers for another 1 to 2 weeks. We will continue to see high numbers in the short term. And so right now we're making this voluntary to give Edmontonians the opportunity to turn this tide before it has a significant impact on acute care use. However, if we see that acute care use starting to increase and meeting those triggers, those are the triggers, again, that we've been very clear with Albertans would be triggering mandatory restrictions.
Operator, could you put through the next question, please?
Thank you. The next question is from David Staples, Edmonton Journal.
Hi, Dr. Hinshaw. In each of the three areas of that you've outlined for changes, could you just tell us what the rules were before for each of those three different areas so we can differentiate what the rules were before and what they are now?
Sure. So the first area is the restriction on social family gatherings. So the official rules or the previous rules were that you could have up to 50 people, 50 people, in a social gathering indoors. And we're changing that now to, again, 15 or 15 people again. So we're shrinking it back to that number that we had previously recommended many months ago when we had most of our restrictions in place. The second one about workplaces. So, of course, we have always recommended that when anyone is in an indoor setting, that they should be wearing masks if they can't maintain that 2 meters of distance from one another. But what we're really focusing on now is we have seen several workplace outbreaks where there seems to be this misconception of workers being in a cohort with each other simply because they work in the same office or the same building. And we want to be really, really clear that is not the case. And we do recommend that when people are in that indoor workplace setting, that they should be wearing masks at all times if there's any chance they might come within 2 meters of each other. And that employers need to be thinking about protecting employees, not just from members of the public if they are a public serving company, but also employees need to be protected from each other as sources of infection. And the third is about cohorts. So previously we recommended that people limit the number of cohorts that they belong to, but we didn't specify a number. Now for the Edmonton zone specifically, again, we're saying that, of course, people have their household cohort and, again, that small social cohort that they may belong to. Then there's school cohorts for children, of course, that if those who are attending school have that as a part of their cohort. We're now saying that the new voluntary measure is that there would only be one additional discretionary cohort that those children would belong to. So, for example, only one sports team outside of school, or only one, for example, if they're part of a dramatic production, it would only be that and nothing else. And as I mentioned, the younger group of children who attend childcare, that could be also allowed up to 4 for those very young children, again, because that doesn't seem to be an area where we've had significant transmission. And again, we know that younger children, at this time, the evidence indicates that they are much less likely to transmit.
Operator, could you put through the next caller, please?
Jason Herring, Post Media.
Good afternoon, Dr. Hinshaw. Just wondering if you have any thoughts on why Calgary has seemed to avoid the kind of rapid surge we're currently seeing in Edmonton. Active cases in Calgary are actually down today.
It's a good question. I don't think we know 100% why that's the case. I can give you a possibility, which may or may not be contributing. We certainly know that in Calgary, in the early part of the pandemic, Calgary consistently had higher case numbers. And so for a very long time, there was quite a lot of work that went into making sure that the population there knew the risks, knew what they needed to do, and to bring it down. And so it's possible, again, I don't know this for sure, but it is possible that because of that, people who live in Calgary have had longer to have the importance of those measures really emphasized for them, whereas in Edmonton, because in the past 8 months, typically Edmonton has had a bit of a lower case count. It's possible that people have maybe not paid as close attention to the rules. Again, I don't know that for sure, but we certainly don't see a massive difference in transmission patterns between Edmonton and Calgary. But again, I would say that this is not the time for complacency. And so people outside of Edmonton, whether in Calgary or other parts of the province, need to continue those precautions that they have in place right now. That is a part of why I believe we are not seeing the same kind of spread outside of the Edmonton region.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. I recognize public health had to look at trends and patterns to see whether restrictions were needed in Edmonton. However, you said since the summer that social gatherings were part of the problem. The city has been on the watch list for weeks now, and the active case rate per 100,000 people is roughly double the threshold for it being on the watch list. How come it took so long for restrictions to be reintroduced? Also, can Edmontonians be blamed for the rise in cases when the rules in this province were relaxed, allowing them to have larger cohorts and hold larger gatherings? Should there have been a slower approach to easing restrictions?
The first question about the timing of this, we of course have seen slightly increasing numbers in Edmonton for some time. What we have been doing is watching, of course, as you know, even in Calgary, we did see rises and falls in case numbers that we were able to bring under control with public health measures. And it's really important, as I've said for a long time, that we consider both the impacts of COVID as well as the impacts of restrictions, and that we're trying to balance between those two. What has changed in the past week in terms of Edmonton is that while Edmonton did have higher case counts for several weeks, those case counts were only increasing slightly or staying relatively stable. And it's only in this past week that we have seen an increase, as I mentioned, in that reproduction number, moving from around 1 to 1.3, and that tipped up very quickly, as well as the sudden increase in those daily case counts. So again, we wanted to make sure that while we were watching closely and making sure that we were doing everything we could at that local outbreak control level, wanting to give opportunities to see if we could bring it under control as we had in other places. And so now we're seeing again that we've tipped into a faster rise in spread. And I believe at this point, again, this is where it's necessary to move into an enhanced mode for Edmonton and provide these additional voluntary measures. With respect to the speed of reopening, I think it's interesting, again, that the same easing of restrictions has happened across the entire province. And while I would say that I am focused on Edmonton, I would hesitate to use the word blame. I think from my perspective, I would say that, again, Edmontonians perhaps haven't had the personal impact of COVID that some others in the province may have experienced. And I know we've done some focus groups in the last month or so to look at the opinions of people and those who maybe aren't following restrictions, what would prompt them to do so. And unfortunately for some people, the answer is that they would follow restrictions if they were personally impacted. So while I think it's really critical that all of us take measures so that we are not personally impacted, for some people, unfortunately, they are more strongly motivated when it hits closer to home. And so we are seeing these rising numbers in Edmonton. It is going to impact more of us. And now is the time to be motivated to turn that tide. But again, this has not impacted the entire province the same way. So I would say that the issue in my mind is not the province-wide easing of restrictions, but rather, unfortunately, some trends in Edmonton right now that I believe we can turn with these voluntary public health measures.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Dustin Cook, Post Media.
Hi, Dr. Hinshaw. I'm wondering, is there any concern that the term voluntary measures doesn't hold enough weight here, and what's the message to Edmontonians to follow these new measures?
The question about whether or not it holds enough weight, I suppose that would be a question for Edmontonians to answer. In my mind, again, what we're doing is saying we made a commitment to Albertans when we started our relaunch that we would be transparent in the measures that would prompt reversals in our easing of restrictions, and those were clearly our acute care utilization metrics. We haven't hit that, and so again, we're keeping our promise to Albertans that those mandatory measures are linked to those two key metrics, and at the same time, by these measures today, we're giving Edmontonians the opportunity to bend that curve before we start to see that significant acute care impact. So it really is up to Edmontonians to pick up this challenge, which I believe we are up to that challenge, and make a difference before we start to see that acute care impact. And again, I think this is something that we can do together.
Operator, could you put through the next caller, please?
Terry Tate, Globe and Mail.
Hi, thanks, Dr. Hinshaw. I'm wondering if there is a plan to tweak the messaging, the way that you're reaching certain groups who maybe are not adhering to public health guidelines, and what changes we might see in the messaging and the strategy.
It's a good question. Certainly we see, as we have for the past several months, that the highest number of cases are still in that 20 to 39-year-old age group, although, of course, that does not mean that others aren't impacted. Current active cases across the province, we have over 500 active cases right now in individuals who are 50 years of age or older. So the messaging is really focused on reminding people that even if they themselves are not at high risk of severe outcomes, their actions matter to those around them. And taking actions to protect each other is, again, the only protection we have from COVID-19. So we are working with a team, as I mentioned, that has been doing some focus group interviews, trying to understand what messages are resonating with people and what motivates people to take different actions. And we haven't completed that work yet, so I don't have specifics. But what I will say, again, is that important message of taking these actions not just for yourself, but for the people around you, and thinking about the people that you love in your life who might be older than 70 or who have chronic medical conditions, and treating everyone around you the way you would want others to treat those that you love. So again, this is about us coming together as a community and helping each other get through this.
All right, operator, could you put through our final question, please?
Sean Frenette, CTV.
Hello, Dr. Hinshaw. Just a quick clarification in addition to my question. The case count today, according to our records, appears to be the biggest case count daily in Alberta so far, surpassing the highest previous day, which was back in April. If you can confirm that, that'd be great. And also, just your reaction to the outbreak that has happened in a church community, the Colehurst Good News Center. Yesterday, we were told it had 20 cases, today 37. How concerned are you about that outbreak right now?
First of all, you're correct. This is our highest case count. I would again reiterate that we are seeing the majority of those cases focused in Edmonton, which is why we're taking the measures we're taking today. The second question about that church outbreak, we have had several outbreaks in faith groups over the past couple of months, and really a critical success factor has been working with leadership in those faith groups. And in this case, like all those others, again, local public health will be working with those leaders. We do know that worshiping and gathering in faith communities can potentially be a risk factor if all of our guidance isn't followed. And so we have had several meetings with faith leaders in our province. And I really appreciate all of the measures that leaders across this province have taken. We have had worship services open with no maximum restrictions since June. And we have seen very few of these outbreaks. Of course, they do happen from time to time. Each one is concerning and does get that follow-up. But again, it's an opportunity to highlight how leaders of faith communities have really stepped up to the challenge and kept their communities safe. And that is something that I would encourage them to continue to do, because again, this is something that can only be prevented by our collective action.
Thank you all for joining us. Dr. Hinshaw will provide the next update on Tuesday afternoon. Have a safe Friday and long weekend.